Hello everyone, today we're going to be talking about medical terminology and the top 200 medications. So after this lecture, you should be able to recognize medications within the top 200 medications filled each year, comprehend common terms used in medical terminology, demonstrate familiarization with the top 200 medications, and demonstrate comprehension of medical terminology. We're going to discuss some of the top 200 medications, including their brand name, generic name, and their classification. We're going to cover common prefixes, suffixes, and root words to help you remember those again this time, but the full list of the 200 medications as well as flashcards, including all of the information that you need, are all located on the website. So we're really just going to dive deep into the ones that are easy to remember based on their prefix, suffix, or root, but all of the rest of them you can find on the website, and it's important that you study those. So starting with prefixes, the big one is going to be Ceph. So if you come across medications that include Ceph in the beginning, the only two currently in the top 200 are Cefdinir and Cephalexin, but again, make sure that you check. Those are going to be cephalosporin antibiotics. Next, for root words, the use of pred is going to mean corticosteroid typically. So the two that typically come to mind are methylprednisolone and prednisone. If you see that pred, it should be an indicator that it's a corticosteroid. And then finally, suffixes. This is where the bread and butter of remembering medications comes in. So if it ends in azone, so fluticasone or mometasone, again, a corticosteroid. If it ends in dipine, so amlodipine and nifedipine are two common ones. Those are calcium channel blockers and they're antihypertensives. If it ends in eprazole, so esomeprazole or omeprazole, they're proton pump inhibitors. We commonly just call these PPIs, but it is important to know the full class name for the exam. If it ends in floxacin, so ciprofloxacin or levofloxacin, it's a fluoroquinolone antibiotic. If it ends in gliptin, so sitagliptin and linagliptin, it is a DPP-4 inhibitor. It's used for diabetes, so it may also be called a blood sugar lowering agent. Olol, or sometimes Alol or Ilol, a combination of the LOL suffix, is going to be your beta blockers. These are antihypertensives as well. You have atenolol, metoprolol, propranolol, timolol, and nebivolol. These are very common medications. If it ends in pril, like benazepril, enalapril, lisinopril, or ramipril, it is an ACE inhibitor or an angiotensin converting enzyme inhibitor, but it's an antihypertensive. It lowers blood pressure. Next, if it ends in sartan, like losartan or valsartan, these are angiotensin II receptor blockers, but they're also antihypertensives. They lower blood pressure. Statins, so atorvastatin, lovastatin, rosuvastatin, and simvastatin are HMG-CoA reductase inhibitors. They are cholesterol-lowering agents, and they are actually commonly called statins as a class. So all of the medications in this class are going to end in statin. Turol, so albuterol, formoterol, and salmeterol, all means beta agonists. These are common asthma treatments. They may also be used as COPD treatments. I would know these as breathing treatments in general, but their specific class is beta agonist. Trel, so desogestrel, etonogestrel, and levonorgestrel, are female hormones, specifically progestins. Tylene, so amitriptyline, nortriptyline, are going to be tricyclic antidepressants. If it has vir at the end, so acyclovir or valcyclovir, it's going to be an antiviral. I think that's one of the easiest ones to remember because VIR is the exact same as a virus, so pretty easy one there. Zepam, so Zepam, and clonazepam, diazepam, lorazepam, and temazepam is a benzodiazepine and a sedative. So, with that being said, that is all of the medical terminology in top 200 that we wanted to go through with you all. Those are the big ones that should help you really ace that section on the exam and start to talk this language better. So, definitely be sure to go on the website, look at the PDF as well as the flashcards, and study really hard. That way you can ace this section. So we're going to start with medical terminology. It's going to introduce common terms, prefixes, and suffixes that we use in the medical field. It's going to help you understand both the course and the career better. Today we're going to focus more on common prefixes, root words, and suffixes for the purpose of this lecture, but there's a PDF and flashcards of other common prefixes, root words, and suffixes that are in the module. So we're really just going to focus on those big ones today. If you want to dive deeper so that you can have a better understanding of medical terminology, we've provided more for you. So starting with prefixes, we're going to go through these individually. So first, if you see a or an in front of a word, it's going to mean without, not, or no. So I like to think of this as atypical, so not typical. Next, anti, against, so antibiotic or antihypertensive. Brady means slow, so bradycardia would mean a slow heart rate. Tachy means the exact opposite, it's fast, so tachycardic is going to be a fast heart rate. Contra means against, so contraindicated, it goes against the indication of the use of the medication. U means good or normal, so you'll hear euthermic, which means the patient has a normal temperature, or euvolemic, meaning that the patient's volume is normal. Hyper means over or above, so hypertension means high blood pressure, hyperglycemia means high blood sugar. Next, we have hypo, which is the exact opposite of hyper, so that's going to be below or under. So hypotension is going to be low blood pressure. I love to think of this as hyper usually means like really excited. You know, when we think of children that are hyper, they're really wound up. So hyper means high, so high blood pressure, high blood sugar, something like that. Iso means equal, so isotonic, meaning the tonicity is the same as the blood or equal to the blood. Leuc means white, so leukocyte is white blood cells. Macro is large, so macrophage, again, a large immune cell. Micro means small, so microscopic, I always think of this as a microscope. Mal means poor, so malnutrition, that's poor nutrition. Pan means all, so pancytopenia, that's going to mean all of your cells. Sub means below or under, so subtherapeutic, meaning it's below the therapeutic threshold. Yeah. Next, we're going to move into root words. That was all of our prefixes that we're going to cover for today. The first root word is going to be andro for male, so androgen. Angio for vessels, so angioedema. Arthro for joints, so arthralgia. This is also where the word arthritis comes from. Buck, that's going to be cheek, so buckle. Card or cardi, that's heart for cardiovascular. Derm or derma, skin for dermatology. Gluc is sugar. Glyc is also sugar, so you may see glucose, glycemic. They kind of are interchanged with each other. Gastro is stomach, so gastrointestinal. Hepato is liver, so hepatitis. Lipid is going to be anything involving the fats, so hyperlipidemia is an example. Myo is typically with muscles, so myocardia would be the muscle around the heart. That's combining two of our root words. It's a great example. Nephro involves the kidneys, so nephrotic. Neuro involves the nerves, like neurology. Oculo is eye. Ophthalmo is also eye, so you may see ocular or ophthalmic. Osteo is bone, so osteoporosis or osteocytes would be a bone cell. Oto is ear, so ototoxicity would be a toxicity related to the ears. Phlebo, vein, so phlebotomy. Psycho would be related to the mind, so antipsychotic or psychiatry is a good example. Pneumo is related to the lungs, just as pulmo is related to the lungs. So pneumonia versus pulmonology, you can interchange them and use them both to refer to the lungs. Reno is referring to the kidneys again, so renal. Rhino is referring to the nose, so a rhinoplasty. Thrombo always refers to a blood clot, so thrombosis. Veno refers to veins again, like venous. And then utero refers to the uterus, such as uterine. So finally, we're going to go through suffixes. So starting with algia, that means pain. So arthralgia would, again, we remembered that arth was from joint in the last root word section. So now combining that with algia, we have joint pain. Anything ending in ase is typically going to be an enzyme, like lactase. Anything ending in logy, so typically like ology is going to be the study of something. So biology is going to be the study of life. Graphy or graph is an instrument for recording, so a radiograph. Gram means to record, so electrocardiogram. Itis is inflammation of, so tonsillitis. I remember when we said arthritis again, it's inflammation of the joint. Osis is a condition, so now we have osteoporosis. So combining our root word with our suffix, we have condition of the bone. Ridge is an excessive flow, so hemorrhage is going to be an excessive flow of blood. Ectomy is the surgical removal, so tonsillectomy. Ologist or just logist is a specialist, so pathologist is a specialist in pathology. Scopy is the viewing of, so endoscopy, colonoscopy, that's all going to be a viewing of that thing. So for a colonoscopy, it'll be the viewing of the colon. Same with scope, it's the instrument that's typically used to do the viewing. So an otoscope is used to view the ears, again, combining two of the aspects we learned, oto meaning ear and scope meaning instrument. Sclerosis is the hardening of whatever you're discussing. So atherosclerosis would be the hardening of arteries, Oma is a tumor, so carcinoma. Cyte is a cell, so osteocyte. Again, we combined these earlier, so osteo meaning blood, cyte meaning cell. So moving on to ectomy, that's the surgical removal of something. So a tonsillectomy would be the surgical removal of your tonsils. Logist or ologist is a specialist, so pathologist would be a specialist in pathology. A scopy is a viewing of something, so an endoscopy or a colonoscopy. Colonoscopy is going to be the viewing of your colon, whereas a scope is typically the instrument that's used to do the viewing. So an otoscope, if we combine that with what we learned earlier, would be an instrument to view the ears because oto is ears. Sclerosis is the hardening of something, so atherosclerosis. Oma typically indicates a tumor, so carcinoma. Cyte is a cell, so osteocyte. Again, combining what we learned earlier, osteo meaning bone, cyte meaning cell, that's a bone cell. Next, we have anemia, which is a blood condition. So anemia, combining what we learned earlier, an in the front means without. Anemia being a blood condition means without blood, so you typically have a shortage of blood. Iatry is treatment, so podiatry. Lysis is the breaking down of something, so hemolysis would be the breaking down of blood. Lytic is to destroy, so very similar to lysis, so osteolytic would be if they're destroying the bone, because remember, osteo means bone. Meter is just a measuring instrument, so again, thermometer measures your temperature. Penia is a decreased number, so neutropenia usually means that there's a decreased number of cells a lot of times. So we learned in the last one in the root words that Luke means white, So adding leukopenia would mean a decreased number of white blood cells. A stomie is an artificial opening, so a colostomy would be an artificial opening in the colon. Moving on. That is the end to your introduction to medical terminology. So we only covered the really big ones, the ones that we think that you'll see pretty commonly or that are really important in conversation just to be able to speak this language. But again, there are more that are included for you on the website. So in conclusion, prefixes, root words, and suffixes are visual tools that can aid in the recognition and comprehension of medication names, as well as common medical terms.